microfinance was the first, before the term social enterprise had been coined, was the first field where there was a real effort both that the end clients were the very poor, and it was to create a business model that would be profitable and also have a major social impact. And that by being profitable, you create an institution that's there in the long term, that can borrow or attract investment and is not reliant on either the whims or the limited capital of donors. And that therefore, if you could do that, you would both provide long-term impact and have an entity to continue to do that. And that the magic way to achieve that was through scale. That the larger you get, the more efficient and profitable you can be, and the more people you reach. So those three key factors of financial sustainability, social impact, and significant scale, microfinance has been grappling with for 30 years.
When you look at the organizations that are operating out there, a lot of them are there for the right reasons and they're doing good work. But now it turns out that this label of microfinance and microcredit has gotten such aura around it, or such halo around it, that now there are organizations that are doing things that in no other industry they would get away with. And they get away with it because they call themselves the social enterprise, or because they say that they're doing microfinance and they're helping the poor. In reality, they just have a business that is, you know, a bottom of the pyramid business, and that it's focusing on the poor, but some of their business practices are hugely questionable and they could not get away with them anywhere else. But oh, so it's microfinance, it must be socially responsible, you get away with it. And that's another, I think, negative result of how much we've sold this story.
There are significant tensions and trade-offs, and some of those have erupted over the last several years as microfinance has in some ways been more successful, I think, than a lot of the people ever who in microfinance thought it could be. So as you become so profitable and you're attracting now private investors, and we're not talking about social investors or foundations, we're talking about hedge funds and investment banks who want to buy this stock, because where else can you get 50% return on equity anywhere in the world? The nature of microfinance changes, and who's attracted to do it, and who's attracted to invest in it, and that has consequences for the end clients, and who is served and how well they're served. And now I think there's been a crisis of conscience within the microfinance community of how do we manage this now, and how do we own up to our role in creating this and figure out a way forward.
Despite the rhetoric, microfinance traditionally is not reaching the poorest of the poor. There are some exceptions, but those are just that. There are exceptions to the rule. And so the question is, why? Is it a matter of cost, that the micro lenders or microfinance institutions are not willing to go downscale that far because the loan sizes and the savings amounts get that to be that small? In most situations that we see, there's actually an unwillingness of the borrowers to even participate, that there's a fear when you're that poor and you really have absolutely nothing. There's a fear of the formal institution, and particularly when there's a group process for admitting you into the process, that you have to be part of a group loan, that they want you to have have some sort of enterprise. You have to have some activity going on, and these are individuals that don't have an activity that would even count as a micro-enterprise.
For people who live on the edge of poverty, it's a dynamic process, and to say we have brought X million people out of poverty is not only questionable, but deeply inaccurate, because it's a question of resilience. And if we set a bar for ourselves, which we have in microfinance, how many people are we moving out of poverty? It's the wrong question. How vulnerable are people still? Are they more resilient? Are they able to sustain a livelihood for longer? Are they able to cover their school fees or a doctor's bill or a funeral expense? And even if the pie is not bigger at the end, if they've managed to survive more reliably and more stably, that's an enormous accomplishment. And that's what I think has to be looked at.
And so we're engaged in a series of projects that are doing, in 7 different places around the world, randomized trials to evaluate the impact of a program that works with the people who are truly at the very bottom in terms of any sort of poverty ranking, as determined both through surveys as well as a community process to help identify the most disadvantaged individuals in the village, and provides them a package of services that's very much in the kind of the big push mentality of development. It provides them training, it provides them a savings account. So it goes back to one of the components of microfinance. But it also provides them perhaps the most important component, a transfer of assets to start a livelihood, for goats. And then also provides consumption support, so bags of rice in order to make sure that they don't have immediate incentives to turn around and sell the goats. And so we're seeing what happens with these studies. Now, one thing that I think is kind of, for some people, these studies started off, or these projects started off as a way of seeing if people could graduate into microfinance. But I think we've successfully changed that rhetoric. That was, I know, something that Tony and I had many conversations about it should be about graduating people out of poverty, and whether that means they end up moving into a loan or not is not a measure of success. That's just a stat, which we would like to know what they're moving on to. But the measure that we care about in this setting is simply, is this a safety net that was produced that helped get someone out of being the ultra poor and actually sustained itself afterwards, or did they fall back?
If you're going to talk about a commitment to poverty alleviation or serving the poor, then you have to actually collect client-level data of what's the poverty level, what's the educational statistics, the health of your clients as they come in, and what are the changes over time. And if you want to talk about being a transformational force in your clients' lives, you cannot do that unless you have that data and you track it in a reliable way and you're willing to be transparent on it.
And that's sort of, I think, where the first wave of, for example, randomized controlled trials in microfinance went. It's like, let's really look at everybody who receives the treatment, and regardless of how they do, and see the average impact. And what started to come out of that is, sometimes underneath what you're doing, there's a more complex story that you're not looking at, because you're just focusing on some dimensions, and you're not focusing on the broader aspect of what it is that you're doing to the client population that you're supposed to be serving. And in some cases, the impacts could be very negative. There's been some famous microfinance people who've said, my grandchildren will not know what poverty was. They will have to go to a dictionary to see what poverty was, because through microfinance we've solved poverty. That's a really dangerous thing to be out there saying, because we haven't, and we have been selling this idea that there are no trade-offs, and the trade-offs are there, and they're huge. And we need to be much more nuanced and much more careful about what we're doing to make decisions on those trade-offs in a much wiser way.